Okay, I'll introduce my team. I have Jamie here, as usual, providing the update, and we also included Becky. She works mostly in our environmental health services, but she has an epidemiology background, infectious disease background, so this is right up her alley. So, so we included her as well as one of our local resources. So we did provide a PowerPoint, so the public can actually see that, hopefully. So Jamie will start us off with our presentation.
Yeah, can you, maybe?
Thank you. Where's my IT? Darren?
This will cost you extra.
Probably one button, Kathy.
It's probably one button. Thank you, Darren. Do you want to sit up here?
All right, well, good morning, Jamie. Do you want to?
Good morning. We'll start with the data. So basically just looking at, currently Clay County has 78 active cases, and this is an increase from 11, which was July 6th. And then Clay County has seen this level continue to rise since May. So Becky puts the data together for us that we share with you, but that just sharing on this slide that we are up from July 6th to 78 now. Minnesota has seen an increase in that time frame and is currently at 9,044. And then Becky also has the data for you for Cass County to compare that. So July 6th, Cass County was sitting at 15 cases, active cases, and currently as of the 16th, they have 243 cases. And then looking at the total for North Dakota on that slide as well. So our local hospitals are seeing an increase in cases, and admissions are steadily increasing. And then also just wanted to let you know that Clay County Public Health continues to provide vaccine opportunities and have been responding to requests from the universities, the K-12 schools, and businesses as they have come up. So then I'll go to the next slide. And this slide, we have the Clay County cases per week. And so you can see how they have been steadily increasing. And then this week, as of through 8/8, we had 52 cases, but the data showed that we were at 78 as of the 16th. And then we'll go to the next slide. And then again, we have the breakdown of the active cases by age. And so you can see that we're seeing a little bit of an increase in cases for the children. And we've had some little daycare cases that have popped up, some positives in the child care. If you think about it, those are the children that have not been vaccinated as of yet. But our highest number continues to be in that 25 to 29, which is what we've seen over time. So.
Jamie, and maybe you're going to get to this, but on the active cases, do we know how many of them are active cases that have had vaccine versus not had vaccine?
And Becky's going to talk to us a little bit
Okay, so
as we get to that.
She's
going to talk about breakthrough cases, and she'll also talk about the Delta variant when we get to that.
Okay, good. Okay, as long as it's coming up, that's good. Thank you.
And then the next slide, we'll look at the total doses administered by Clay County Public Health. And you can see, that we had a very slow period of time, and now things have started to increase. So this goes through 8/8, and it was 133 vaccines that we're providing. Last week, we had an opportunity for Pfizer and Johnson & Johnson, and we were pretty busy. There were people in the hallway at the Family Service Center, so we were happy to see that people are taking advantage of that $100 that would be available for a vaccine, and also the fact that there's information in there in the news about the increase in cases. So we did see an increase, and we also have a clinic planned this week on Thursday, and that one will be from 2 to 6. So we're still continuing to provide vaccines.
Service Center too?
Family Service Center.
Okay.
Yep. Okay, and then we'll go to the next slide. And so this is just, we put this in to show we've had some opportunities to work with MSUM and serving the public and also their staff and the students as they've come in. So this one was on a Sunday, and we had a fairly decent response. It wasn't a lot of people on campus yet, But we were there again last week, and then we also are planning to be there on Saturday, the 21st, for vaccines there. We've got some plans with M-State. We've reached out to Concordia. We were at Moorhead School, K-12 school yesterday, and we've been in the DGF school. So just to let you know, we're out there wherever we can provide vaccine. Okay, the next slide, we're just sharing with you the statewide data. And so statewide for Minnesota, we're still, right under 70, so 68.9 for the number of individuals that have had at least one vaccine. And then for 64.6 for those that have completed the vaccine series. And then we have the breakdown by the age group for you as well. So the data, I believe, is the 16, that top one, the number of one vaccine is 16 and greater, right, Becky? Right. Okay, so that's where we're at for the 16 and up. And as we've seen all along, our highest response to the vaccine has been in that 65 and over. Okay.
And just so you know, the Clay County, we've talked about this every week almost, that our data isn't accurate because we couldn't get the North Dakota pharmacies information. That went directly to the federal agencies. And we also couldn't get VA information. They weren't in part of our immunization registry in Minnesota. So we know it was inaccurate. Minnesota Department of Health knew it was inaccurate. So we hesitate to, it looks
Our
like
numbers are higher then.
well, yeah, and we're convinced, as well as MDH, that we're closer to the state rate. So that's why we've just put the statewide data on there. Okay, and then I'll talk about the level of community transmission. So you can see from the left depiction of Minnesota through the period of July 26th through August 1st, there's a lot of yellow, and yellow is moderate transmission. There's even some blue, which is low transmission. So, in that period of time, there was just a little bit of areas that were in red. Now you see, starting August 8th, and this is through the 14th, there's no blue anymore across the state. There's limited numbers of areas that are still in yellow. Low again or blue is low transmission. Yellow is moderate transmission. Orange is substantial. So Clay County is still in the substantial rate. And then the high is the highest level that CDC has, and that's the high level of transmission. And so the indicators are, it's the number of total cases per 100,000 in a 7-day period, as well as a percentage in the 7-day period. So we were in moderate just a week ago, a little over a week ago. So quickly changed to substantial. We don't really have a scientific prediction about when we may get into the high transmission. It's most likely inevitable that we'll hit high transmission with the numbers rising. Cass County in North Dakota is at that level. So there's communities around us as well. Otter Tail is in the high transmission. Becker is still in substantial, and Wilkin County is in substantial. Douglas County, I believe, is in high as well. So, there's a number of counties around us that are at least substantial or high transmission. And then I'll let Becky talk about the Delta variant.
I'm sure by now everyone has heard at least a little bit about the Delta variant. It's all across the news and is kind of the hot topic right now. And as we continue to learn more.
Excuse me, just, Kathy, I'm wondering if we can get a little more introduction of her and for the public, and she has an epidemiology background.
Correct.
And what is that?
Yeah.
For the public.
And so
You-
I'll
you-
let,
that's-
and Becky was, she's hired to do food, pool, and lodging, all the environmental health services along with Kent. But the beauty of having Becky is she has that infectious disease background, and Becky can talk a minute about that, and epidemiology background. And Becky also served throughout COVID with our contact tracing case investigators. She would serve as a lead and training our variable hour people that we hired into that area. So Becky can talk about her epidemiology background.
So I have a bachelor's in microbiology, and then I have a master's of public health and management of infectious disease. So basically infectious disease epidemiology.
Is your business.
Yeah, that's my real passion.
Your love.
Environmental health is the
Secondary.
side job. So yeah, throughout the course of the pandemic, I had.
So you'd probably know more about it than I would,
Well,
right?
I don't know.
Okay. I'm trying to make a few points here.
So as Kathy stated, I started the case investigation and contact tracing team here at the county what was that? May 2020, over a year ago. I don't know where the time has gone. And then also have served other roles as well, public information and doing the data every week, so.
And she does know, Jamie and I are nurses, so Becky knows a lot more about the infectious disease than we do, so we can acknowledge that.
Well, I also understand you two both know a lot more than I do about it. All right, you can.
Okay, so I'm sure everyone's heard of the Delta variant. It's, like I said, a hot topic right now. We're still continuing to learn more about it, as unfortunately it's spreading rapidly across the country. Even here in Minnesota, as you can see, it's thought to cause at least 95% of the current cases that we're seeing. And Clay County, unfortunately, is no exception. We are seeing the variant here now as well. It is driving the current surge that we're seeing nationwide. The Delta variant is thought to be more than 2 times more infectious as the original SARS-CoV-2 strain was. And that's the strain, the original one that we saw early on in the pandemic. So as you can see in this graphic, on average, an infected person would infect 2 other vulnerable people that they were in close contact with. With the Delta variant, we're seeing that 1 infected person can infect up to 5 people that they're in close contact with. So much, much more infectious. And because of that, we're really seeing exponential growth of cases throughout the U.S. And there's a lot of reasons for that. One of the biological reasons is that this variant is much better at attaching to our cells and gaining entry. So it doesn't require as many viral particles to be circulating in the air to infect somebody. So as I said, there's more. I'm sure we'll learn more as time goes on with that as well.
And that's been determined by research.
Correct, yeah. And so it's also more efficient at infecting younger people, which we're seeing. Early on in the pandemic, we wouldn't see very many young children that would become infected, even in households where, let's say mom and dad were infected. We wouldn't see the children picking that up, or in daycare settings or school settings. So now, with our case investigation calls, we're interviewing whole families. We're interviewing kids at daycare centers where the provider was infected, and so it's definitely has been a change in these last several weeks. That being said, the unvaccinated group is by far at the greatest risk, so we urge everybody to get the vaccine if they have not done so yet. You can go to the next slide. So we have seen some breakthrough cases, and this is statewide data here. It's hard to get local data. There's for a multitude of reasons, but there is a lag in reporting, because as we interview a positive case, the state health department has a separate interview process for those that have been vaccinated, so then we have to verify that they have actually been vaccinated and that they've been fully vaccinated, which is 14 days after their last dose of vaccine. But you can see, looking at these numbers here, the rate is about 0.24% of breakthrough cases. So out of the number of people that have been vaccinated in Minnesota, it's a very, very small proportion of people that wind up becoming infected. And then really negligible hospitalizations and deaths. Almost
99.76% of the people that are vaccinated
Right.
are okay.
Yeah, those numbers are hard to dispute. And, the main message is that, yes, you may wind up becoming infected with COVID just because it's rampant right now in our community. The community transmission is so high, but it's keeping people out of the hospital. And even this number is over-reported, the 0.02%. So that also includes people that are admitted for another procedure, and they're not having COVID symptoms, but they're required to be tested. And so they wind up testing positive, but they're actually in the hospital for another procedure. So that number is included in the 0.02%. So a little caveat to looking at those numbers. So again, main message, if you have not gotten the vaccine, now is the time to do that.
Just a question on these numbers.
Yeah.
They are actual verified cases. We're not projecting into the general population.
Correct. Yep.
For people who may be light or asymptomatic. So we can
Right.
conclude that possibly these are higher.
Correct.
In
Yep.
real world.
Yep, yep. And likely, yeah, it may not include those that are asymptomatic that aren't being tested. Right.
But again, if you're vaccinated and you get COVID, there's a high chance it's going to be lower asymptomatic as opposed to,
Yeah.
Okay.
And we're seeing that trend across the country too. The southern states right now particularly are hit very hard with hospitalizations, and 99% of the people that are hospitalized are the unvaccinated. So it's really become a pandemic of the unvaccinated.
And just, oh, go ahead.
I had just a couple of questions in terms of the Delta variant, whether it's any of you three want to answer it, but are we seeing, is there any difference in the three types of vaccines and the Delta variant? Is there any difference? Is there any scientific knowledge? For example, there's some people that say, well, the Johnson & Johnson doesn't stand up to Delta. Is there anything scientific about that?
I think the jury is still out on that. I have not seen any studies. I know there's a lot of anecdotal stories out there.
Right, well, yeah,
But I have not seen anything scientific to back.
okay,
to back
so,
it up yet.
so there's no public scientific data that would suggest
Not that I'm
one
aware of.
works better than another?
Yeah, not that I'm aware of at this point in time.
Again, I'm asking these questions because I'm being asked to ask it by others, so. All right, and then Kathy or Jamie, the August 16th number of 78, I don't mean to put you on the spot here, but how does that compare with our previous high peak of active cases?
Kathy brought that, in case the question.
You anticipate that?
Thanks for sending me that message. We were pretty high with our active cases. I'll just,
I think
back in
Commissioner,
April, we had a lot of high,
Our previous high, April 4th, was 230 cases.
And April
And our
9th
all-time high was November 8th or 11th. I can't read that.
actually, April 13th, we had
665.
319 cases. So
Yeah,
that was a pretty high number.
665 in November.
Yeah, and November was another peak, yep. So in April, we had a number of, every week, we had a number of cases close to the 200 to 300.
but at one point, we had an all-time high in the 600 and some number.
Correct. Yep.
Compared,
Is that total cases or new cases that week? What is the number that you're talking
Reported
about right now?
cases weekly.
New reported cases, okay.
active
you.
cases.
So yeah, those numbers were quite high in those two areas, the 2 months that we really had the high peaks.
So I mean, the numbers as they're rising is alarming, but it's still, it's also, COVID was running rampant then too, but it's also showing the significance of vaccination. That our number, otherwise, we could be seeing numbers in that 600 range again, so I guess that's my point I'm trying to make.
Can I
And-
ask a quick question?
Yes.
But our testing rates are also significantly lower than they were at that point in time too, correct? Do you know what our testing rates are now?
You know what, and I apologize, I didn't
Sorry, we're
bring
asking
that,
so
but,
many questions.
We get our weekly, I forgot to bring that, I apologize. We're still doing weekly testing, of course, in our saliva testing site, which will remain open through the end of the year. So we verified that yesterday, so that's good news. But people can also go over to Fargo, they have a testing site. So, we wouldn't know the numbers of what that may be at the Fargo site. But Minnesota, or the Moorhead testing site, we're seeing numbers go up with testing. So it was a lull for a little while, and now we're seeing more people getting tested again.
So I know back last year when this was peaking, that there were a lot of employers that were requiring their employees to go and get tested weekly. And do we know if that's still happening for teachers or daycare providers, things like that? So is that potentially affecting our numbers because there are less asymptomatic people getting tested on a regular basis?
So what we do know is that long-term care and assisted livings continue to test based on what their cases are, you know. We also know that now the Minnesota Department of Health is recommending that if you've been exposed to a positive case, even if you've been vaccinated, that you get tested. And so the fact that those two things are happening, we will see an increase in the number of people that are being tested. So, right, you know, for a period of time there, we were told that if we were vaccinated, we had symptoms, we didn't need to be tested, we just needed to stay home. But now the recommendation is that we be tested because we know there's more virus in the community now as well. So, as far as the schools go, you know, I'm not sure where that is as they're planning to open up school. But the recommendation from the Minnesota Department of Health, if you are, you know, in a large group setting with unvaccinated people, that you be tested. So there's more stress of getting tested. So we're appreciative of the fact that we still have the saliva testing site in our community.
Yeah, and you know, an important thing though too is there's still the positivity rate.
Yes, exactly.
You know, that happened in November when we had 600 and some, and there is a positivity rate today. And so based on the numbers, you still have a certain percentage of those tested, test positive, and that becomes your positive
Exactly.
rate.
Exactly.
And, you know, so that's something I think it's probably, I would imagine that's important for you folks to watch, right?
Yes.
Correct.
For our school districts to watch
Correct.
and what those positivity rates are.
Absolutely.
All right. Yes, Commissioner Ebinger.
Are we still actively doing contact tracing? Good.
We are talking about bringing more on board too, as we're anticipating our numbers to continue to increase.
I think it's important we keep up with that and whatever we need to do to facilitate that, I think. Feel free to ask or let us know.
Okay, yeah, I think it's important to keep it up as well, and we lost a few people that kind of were with us from the beginning, based on their jobs and other things, so some of the counties around us stopped doing contact tracing, but we've been able to keep up with it, so I think it's important to have that local contact. I think that's really beneficial.
Going to Commissioner Ebinger's comment to it, I agree, it's really important to do that, and I think you're going to have to keep us, in the past, that contact tracing we were able to use out of the previous CARES dollars too, and you actually had some extra state funding that did that. I don't know if you have that or not, but you need to make sure that you keep us informed there so that we don't want to let that slide,
Okay,
right?
thanks, yes,
So if-
we'll do that.
If it becomes a budgetary deal, then our CARES 2 should hear about it.
Okay, perfect. Also, just to note, the infectious disease doctors across America are saying, you know, that they were toting the 70% herd immunity. That was really important. Now with the Delta variant, they say we need to ramp that up. It needs to be a higher herd immunity to really keep people safe. So as Becky mentioned, and Jamie too, is we just really, really encourage the unvaccinated to get vaccinated. That will really help in the herd immunity. So that's a real priority. We talk about masks, and that's
Just before you go to the mask, can I ask one other question? And I do try to follow this from a national level too whenever I get a chance, and obviously there's a lot of concern about very young children now. We're starting to see some changes in the Delta variant and kids becoming sicker. What's the latest on vaccine potential? I think I heard something about maybe children 5 to 12 might be coming in the near future. Have you heard any more internally on that, or?
I don't know, Becky, you heard any more? They're working on a vaccine. The American Academy of Pediatricians are really pushing to move that along so we can get those younger kids vaccinated.
These are doctors.
Correct. These are doctors. And they're really strongly recommending that we do need to get, trying to push it along, not not beyond safety measures. They'll continue to have the safety measures, but they really want that to ramp up as quickly as they can, giving them all the resources so we can get that vaccine for the younger kids. Now, I haven't heard from MDH when that potentially will be. Becky, have you heard anything?
I've heard a few different timelines thrown out there, but I
Okay, nothing you're,
I
okay,
think credible.
okay. Other than, hopefully it's sooner rather than later.
Absolutely.
Mr. Chair?
Yes.
Just a follow-up with that. You mentioned that the incidence of disease is higher in kids. Can you talk about what kinds of symptoms and how severe it has been? You know, is it just still a mild cold, or what are we seeing with kids that are infected with Delta?
What I've seen typically, you know, largely kids are not as affected as severely as older adults. You know, they're just kind of more the cold symptoms, the headache, the sore throat, the fever, feeling lethargic, things like that.
High temperature?
Fever, yep, fever, I've seen that, yep. Yeah.
Anything beyond that, or?
Not that I've dealt with personally, I
Okay.
guess, but.
So, for young parents with young kids that might be watching this, what would be an indicators, as Commissioner Cayley was talking about, where they should take action and bring them in? What would be your suggestion there?
Well, I think anytime a parent has a concern.
Of course, yeah.
You know, if they've been exposed to someone with COVID and they're having some of these classic COVID symptoms, definitely reaching out to your medical provider and seeing if they want to be tested. I guess I have 5 young children too, and when in doubt, bring them in if you're concerned.
Okay,
Okay.
all right, masks,
Masks.
great subject.
Oh, great subject. And we just wanted to, provide information about what Minnesota Department of Health, Center for Disease Control, and our local health systems, and what they're doing as far as recommendations. So all of those are recommending wearing masks in indoor public settings in areas where there's substantial and high. I talked about the levels of transmission that the CDC put out. So this is the recommendation from those organizations that that we partner with all the time. Now, I did reach out to Cass County in North Dakota, their public health department, their city, they're under the city, and their city has not determined that they're going to recommend or require masks at this time. They're in the high level of transmission. Their public health department is in their own separate building, so their public health department is having their visitors mask when they come in, irregardless of their vaccine status. And they, as employees, are masking as well, but there's no other city requirement for city employees. That's in Cass County. I reached out to our regional other counties. Becker County is not, at this point, making a change in their recommendation for masks. They did the same thing as we did, where we offered masks and recommended masks for those visitors that come in that were not vaccinated. We also recommended masks for those employees that weren't vaccinated. So Becker County is still, they haven't changed that, their criteria. Otter Tail is still working. Now, Otter Tail is in red again, the high transmission. Otter Tail is, they haven't made a determination yet. Their board has not. They're going to be discussing it further about what their recommendation would be, so they have not made a recommendation beyond what I just talked about with the original recommendations, nor has Wilkin County. So our surrounding counties are still talking through masking. So just so you have kind of a sense of what's happening around us as well. Anything else to add to my team? No?
Kathy, are you offering a vaccination clinic at the Moorhead High School today? Did I see?
The Moorhead High School was
were there yesterday.
yesterday. And they might have another one set up.
My knowledge.
So,
They did yesterday.
Well, I know Commissioner Campbell and I had met yesterday as part of the American Rescue Committee, and you were part of that. And
And there are still groups out there that have people amongst them that want to get vaccinated and have, for whatever reason, had a issue finding availability. And I know that your department has been open and willing to go into groups or to places of worship or community centers and host vaccination clinics. So for anyone watching, that availability is still out there and that offer is there. And so to contact the public health department and you can coordinate it with them. So thank you.
Perfect. We also told, thanks for that, we told the schools as well, and in higher ed, we'll vaccinate parents. And we're coming to their location, not just for the students, but we're offering it to teachers, we're offering it to parents. Anyone can come to those sites as well, so.
Mr. Chair.
Yes.
So this is the recommendation that you shared here doesn't say whether or not vaccinated or unvaccinated people should be wearing masks. That's not called out. But in a post that Clay County Public Health shared yesterday, which was from the CDC, it was a share from the CDC post on, I think it was the 16th. They're saying that the quote is, wear a mask indoors in public if you are in an area of substantial or high transmission, even if you are fully vaccinated.
Correct.
So with that in mind, and with what you said earlier about it's inevitable when we will go to high, it's going to happen, it's just a matter of when. I would like to see us institute a mask mandate for county buildings. I think we can be a leader for our surrounding counties in making the choice for safety and protecting human lives. There's science and math and good common sense behind mask wearing. And so I don't know if you want to do that this week since Frank is not here, if you would like the full board to be a part of that decision. But that's just my feelings.
I do believe the full board would be, and my comment that I was going to make just before you made that is that I got to depend on you to tell us when and if that should happen. And, so that's where I'm looking to is the experts. We can be proactive and do some things, but the opposite side of that is when would we know to remove it too? Because, so we depend on your expertise in that matter too. What I was going to say, Kathy, is if you feel the necessity to do something in our county buildings, then you should let us know. But in the meantime, we also have to understand that since this started, we have done an awful lot in our county facilities to help avoid the spread of COVID. Just for our employees and for our citizens to know, we have tried to make these public buildings safe. And if you determine from your professional standpoint that it isn't, then we need to know about it. But again, I think any discussion about any complete campus-wide deal, I believe we should have all 5 commissioners.
I mean, you certainly are welcome to make a motion at any point.
Sure, yeah. Yes.
Commissioner Campbell, if I may.
Yes.
Follow up.
Yep. Commissioner Mojo.
We did spend a substantial amount of time discussing how to use CARES funds in a way to help mitigate infectious disease, not just COVID. And I felt that we really tried to find ways to make services for citizens available in person, over the phone, online, in person or not in person. And I know that I've seen the courts, maybe Brian, I noticed the signs for masking is down now for courts. Is that required?
Currently, the courts are not requiring masking, but it's per county and dependent on if they're getting up into the level of
Yep,
substantial or high. So some counties have been hitting that high level, and they're requiring a mask in the courts.
And so I think that for the business that's done within our county buildings, I certainly feel as though we've taken all efforts to reduce contact and be mindful of where transmission could happen. I certainly see that there are spikes out there, and we've seen spikes before, and really would hope that we as public health could continue to educate folks or make available the opportunity to vaccinate if they so choose. Certainly there are citizens that don't wish to do so, and that's fine. We all have choices, and we all have that choice, and it's for that I would still support the availability for folks to choose if they wanted to mask in public or if they didn't want to.
I want to bring up, I mentioned that I do kind of follow nationally, and I saw a report nationally on the most recent 120,000 new cases. The information was that 95% of those new cases were not vaccinated. 95% of the 120,000 were not vaccinated. Almost 100% of the hospitalizations were people not vaccinated. I'm just sharing that. It seems to me that there should become some common sense here. I'm obviously, I agree, it's one's choice to be vaccinated or not, but the numbers indicate that it's probably a good deal to do it. So, Commissioner Ebinger.
This is putting a sort of a difficult task on your shoulders. But I spent a lot of last week in the Twin Cities visiting my father-in-law in a nursing home, and spend a lot, long periods of time in a mask. You go to hospitals or a doctor's appointment, now you mask up. It occurs to me that the two things that are going to end this virus are the transmission of the virus, and God forbid we get other variants of it that are even more effective, and that happens through transmission and mutation. The transmission of it through contact and the infection you get within your body, so you're transmitting it. There's two ways we can deal with that, or three ways actual: social distancing, masking, and vaccine. And I don't like the thought of asking our employees or our citizens to have to wear masks and go through that again. But I also don't like the idea of COVID, especially this variant, affecting our workforce, affecting our citizens. And you look at this map, and it's getting awful red around here. And we're pretty close to that, and I agree with you. It's inevitable. It's going to happen. I don't want to, I was ready to second Commissioner Cayley's motion on this, but I agree. We should have the full commission here to discuss this. But I also, Kathy, we've imposed on you a lot in the last 16 months, and we'll impose again. If you and your staff have input on this, I think we're ready to hear it, at least next week, but I think this is something we need to move on. And I don't like doing this. I don't like wearing a mask. I sat in my car this morning and looked at my mask and came in without it, and that was bad on me. So I think this is at least a topic that's worth a discussion, and it's better that than to lose people like some of us right here have had happen. So I'd encourage you to tell us your thoughts whenever you're ready to.
Sure.
I know it's a difficult spot to put you in. You're also the professionals in this field, and I'm not. I don't want to shoot from the hip. I want to hear from you.
Sure.
And Mr. Chair, if I could maybe, I would just mention to the board, and as you're thinking about issues of whether or not, countywide mask mandate, county facility mask mandate, those types of things, I mean, you can look at, I would just ask, as you do, for the next week, if you're thinking of those types of things and looking at some research, currently statewide mask mandates, there are 12 states that have them. The remaining states don't have a full mask mandate across the state. If you look at some of the research or some of the things that are happening, I mean, obviously a mask mandate by a county can be controversial. And so there have been some constitutional challenges that have been happening in some of the states. So I just ask you to look at that. I mean, it's very likely impossible if the county was to do mask mandate. It garners the potential for court challenge. Whatever happens, whatever the board votes, that's what I'm going to defend. And so just have to be aware that may potentially garner some litigation depending on what happens. So I just point that out. I just note I've been looking at it, just knowing that this is a possibility coming up. But some states that did not have a mask mandate and then counties implemented one and garnered a constitutional challenge, at least two that, well, in Florida, there were variable differences. One judge upheld it, one did not, and now it's up into their Supreme Court. Where Texas, where they challenged it, the Supreme Court shot down mask mandates by two separate counties. So that has happened already. So those are some things that are happening, but each state is going to be different potentially. So I just point that out that I don't doubt that if and when the county chooses to, if they act on their own, it has the potential to garner potential litigation. So I just point that out.
Commissioner Eppinger.
Speaking for myself, I think we're overreaching to talk about a countywide mandate. This would be our facilities.
Agreed.
I'm interested in discussing.
Well, we've never done anything but that.
Yeah. Mm-hmm.
I certainly hope that those who haven't been vaccinated will follow guidelines and mask up.
Correct.
Without us having to suggest or tell them to.
Correct.
Let's see how it goes. And again, anytime you feel it's important to be before this board with concerns and recommendations, we want to hear about it. And I think I can speak for our entire board when it comes to that. So.
Mr. Chair and Commissioners, we certainly can come back next week if the whole board will be here and have further discussion, if that's what.
All right. Well, why don't we?
And Mr. Chair, I only wanted to point out, I think there was some discussion, but I just want to make sure it's clear there is a quorum here. So, I mean, the board could act in one way or the other. I mean, it's all about making a motion,
right, having
a second and a vote. If you want to do that, you have a quorum to do that. I just want to make sure that's clear. There's no requirement to wait, but you're free to wait. So, okay. I just want to make sure that was clear.
All right, so I think just with where things are going, let's keep you back on next week, and we'll go from there in terms of if we want to have an every week deal again for a while.
Sure.
And thank you for bringing our epidemiologist along.
Yep, thank you.
Absolutely.
All right. Okay, thank you.
Okay, thank you.